Good morning again. It is still morning. Today, continuing in Hope and Resiliency regarding Milton Erickson's life and work. It's not by him, but it's by associates, his wife, and his daughter. So the previous recording video, we talked about his core 6 strategies, and this is distraction pointed out, so specific description with case studies included. So I'll read a good portion of this chapter, which is chapter 7, so you can get the idea of how he uses distraction with his clients. He calls them patients. He's an MD, or was. So distraction. Case report. The old gentleman who was scared of elevators. An elderly gentleman came to Erickson for help with the long-standing fear of elevators. He had worked at the top of a tall building for many years and had always had to walk up using the stairs. However, this solution became less feasible as he became older. Erickson knew this was a prudish man who was married to a prudish wife. After listening, I just smile at the way these terms that they use with their clients about them. After listening to him ask if he could be helped with his fear of elevators, Erickson confidently responded, "I will probably scare the pants off of you in another direction." The man responded that nothing could be worse than his fear of an elevator. This was during the 1940s when elevators had operators. In this man's building, the operators were young females. Erickson met in advance with one of the attendants in order to make special arrangements. The female operator agreed to cooperate and thought Erickson's idea sounded as though it would be fun. The following day, Erickson escorted the gentleman to the office building. As the man had explained earlier, he was not afraid of walking into the elevator, but when it began to move, the experience became unbearable. So Erickson had him practice going in and out of the elevator. Then at a moment when both Erickson and the man were fully inside the elevator, Erickson told the girl to close the door and said, "Let's go up." She took the elevator up 1 story and stopped it between 2 floors. The man began to yell, "What's wrong?" Erickson said, "The elevator girl wants to kiss you." Shocked, the gentleman said, "But I'm a married man." The girl said, "I don't mind that." She walked toward him. He stepped back and said, "You start the elevator." So she started it. She went up to the 4th floor and stopped again between floors. She says, "I just have a craving for a kiss." He said, "You go on about your business." He wanted the elevator moving, not standing still. She replied, "Well, let's go down and start all over again." And she began to take the elevator down. He said, "Not down, up," as he did not want to go through that all over again. She started the elevator and then stopped between floors again and said, "Do you promise that you will ride down in my elevator with me when you're through with work?" He said, "I'll promise anything if you will promise not to kiss me." From then on, he was able to ride without fear. That's distraction. Distraction is a strategy that is particularly useful for counteracting the effects of self-fulfilling prophecies or highly conditioned responses to feared stimuli. This is obviously commentary after that case study. Perhaps the most classic example is the frightened child or adult who must receive an injection. Just the sight of the needle is enough to produce hypersensitivity in the nerves and hypertension in the muscles. A child might even attempt to escape, thereby resulting in restraint, which increases the fear of the situation as it turns into a vicious cycle. The end result is a dramatic increase in the amount of pain experienced by the child and subsequent trauma. However, when the child is told to look at a bowl of candy and decide which color she wants, and the needle is kept out of sight, it is possible the small prick might go undetected. During his residency, Erickson developed a clever method of distraction for similar situations. As the patient sat waiting for the painful medical procedure, Erickson would comment, "I just hope you don't get that slowpoke nurse. It will be so much less painful if you get the nurse with the quick hands." In this way, the patient's attention was entirely distracted by who the nurse was and how Erickson responded to her arrival. Did he seem relieved? If so, the patient would relax and just wonder how painful it would have been if he would have gotten the wrong nurse. In regard to psychological distress, there are many conditions that become chronic or worsen over time due to the effects of self-fulfilling prophecy. Anytime the patient strongly anticipates a negative outcome, this expectation alone may sustain symptomatic behaviors that would have otherwise diminished. An example is the spiraling effect created by the person who is so nervous that he or she will stutter during conversation that he can hardly speak. Another example is the young child with asthma who becomes so fearful of having another attack that he tenses all the muscles in his chest, hardly leaving any room for the inflation of the lungs. A common scenario with depression is that patients begin to experience feelings of hopelessness or worthlessness and respond by staying in bed all day or watching TV for 12 straight hours, or finishing off a bottle of vodka. These behaviors make them feel even worse about themselves, thus feeding the cycle of depression. This case story is called Red Herring, the girl who could not bear to be watched. A girl with tremendous anxiety came to Phoenix to receive therapy from Erickson. Her behavior was extremely rigid and limiting. She had rituals around dressing. It had to be done in a certain way. She had a rigid ritual for reading her mail. She would sit only on certain objects. She would live only in a certain apartment, and she had a constant compulsion to clean herself. On some days, she would spend as long as 19 hours bathing. According to Erickson, one of the first things I did, he said, was to let her tell me what utterly intense anxiety she had while trying to get herself clean. During this conversation, the girl tried to convince Erickson that she was completely absorbed in this tremendous anxiety. He had her tell her story at length, and as soon as she had convinced herself that the anxiety was so awful that she could be aware of nothing else, he agreed with her. With great curiosity, he asked, "As absorbed as you will be in this awful anxiety while showering, you will not mind if I watch you." He described her reaction to the statement as being greatly jarred, practically loose from her teeth. It should be clear that Erickson had not said that he would do such a thing. He merely asked a curious question to expand her rigid perspective, but she did not want to even speculate on the possibility. She was forced to admit that she just could not tolerate such a thing. Erickson argued her previous position. "Surely you will be so absorbed in your anxiety that you will not know anyone is there." At this point, her anxiety over showering no longer seemed so absorbing. Next, Erickson pointed out, "Really, it is not so bad that you would be so absorbed in your anxiety that you would be unaware of someone watching you. In fact, I would be willing to bet that I could just rattle the door to the bathroom and you would notice it." Then Erickson pointed out that just wondering if he would come over and rattle it would be enough to keep her distracted from what she had previously perceived as an inescapable anxiety. The expression "red herring" comes from the practice of a hunted man drawing this type of fish across the trail in order to distract hounds. Not just drawing, but dragging. In therapy, emotionally charged decoys can be used to distract the patient so that the focus of attention is narrowed and kept from otherwise overwhelming aspects of the situation. Erickson often explained this technique using examples from dentistry. Many of his patients were terrified of a trip to the dentist, especially if a syringe was going to be used. So Erickson would advise the dentist to have the patient sitting in such a position that he could see or she could see the tray holding a big, long needle. When the dentist entered the room, his statement was, "I will use hypnosis first, and that should block the pain. But if you start to become uncomfortable, then we can use that shot over there." The needle is the red herring that distracts the patient from what the dentist is doing to the teeth. Another type of distraction, questioning and presupposition. Here's a case report. The homicidal patient in the elevator. While working at a psychiatric hospital late in the night, Erickson found himself suddenly trapped in a dangerous situation. A homicidal patient had hidden himself in an elevator, and Erickson did not see him until after he had stepped in and slammed the door shut. It locked automatically. And although Erickson had a key to unlock it, he did not have the time needed to escape. The homicidal patient serenely stated, "I've been waiting for you to make the evening rounds. Everyone is down at the other end of the ward, and I'm going to kill you." Erickson's statement was just as simple. "Well, you're going to do the slaughter right there or over there." The patient looked at I'm sorry, that was a question. Erickson's statement was just as simple. "Well, are you going to do the slaughter right there or over there?" The patient looked at the first spot Erickson had chosen and then at the second. As he did this, Erickson opened the door and said, "Of course, there is a chair over there that you could sit in afterwards. That is true, you know. And at the same time, there is a chair down there." And as he spoke, Erickson began walking. "And there is another chair over there and another spot at the other end of the corridor." The patient walked along with Erickson, looking at each spot that he could pick for Erickson's demise. Eventually, they arrived at the station where the attendants were gathered. One of the most effective means of creating an immediate distraction is to ask a question. Questions are highly distracting and usually compel the person to think about what has been asked. In fact, most people have become conditioned to the idea that they must think about and answer questions once they are asked. This is why salespeople are trained to respond to resistance with a complex series of questions. The mantra taught to sales trainees is, "The person asking the questions is the person who is in control of the conversation." The term presupposition, used to describe a linguistic maneuver in which one statement presupposes the validity of another. Although presupposition can occur without the use of questions, it works especially well with implied meanings hidden beneath the surface of the question. Be aware of that whenever someone asks you a question that is based in their own life presuppositions, where they expect you and anticipate you moving over, down, around to their basis of understanding of life, and then you answering their question on their terms. It may or may not be understood that that's what's happening, but if you feel stumped, maybe that their presupposition about life is different than yours. So you don't have to answer the question based on their presupposition. For instance, the question, "Are you aware of the progress you have made during this first visit?" obviously implies that progress has been made. Yet the patient's attention is distracted by the question of awareness. The question, "Will you be ready to get over that habit this week or the next?" can also be viewed as a double bind. However, essentially, the question acts as distraction from the other less desirable thought. I might never recover. Distraction from that thought using the questions given. When faced with an interesting question, one that seems meaningful or important, patients are likely to focus on their answer rather than on the underlying implications. Questions that focus the attention on the issue of time contain a strong psychological implication that the desired outcome will be achieved. As a rule, more power is added to the method of distraction when emotions are involved. When done in the proper manner, distraction is not used as a trick, but instead as an avenue to legitimate therapeutic objectives. When the homicidal patient made his statement to Erickson, he undoubtedly wanted to be taken seriously. As Erickson explains, I accepted the idea that the patient was going to kill me. Then, with his statement accepted, the patient was free to search for an answer to Erickson's questions. Emphasis on detail. Case report. Alan's bleeding leg. While playing outside, Erickson's 7-year-old son, Alan, fell on a broken bottle and slashed his leg open. Alan came into the house screaming. His leg was bleeding profusely. When Alan paused to get a breath for the next scream, Erickson gave a very urgent instruction. Get a big towel, Alan. Not the small one. Get a big towel. A big towel. After Alan accomplished that, Erickson instructed him, for heaven's sake, wrap it tightly, not loosely. Wrap it tightly. Wrap it tightly. After Alan finished wrapping his leg, Erickson was able to approve of the good job he had done. The towel was nice and tight, and Alan was no longer crying. Most people have had the experience of being so completely absorbed in a complex task that there was no attention left to consider other immediate circumstances. If a task is important enough and it requires close attention to detail, after completing stimuli, if a task is important enough and it requires close attention to detail, other competing stimuli are ignored. In the case of Erickson's son, Alan, it was the pain and fear of injury that was shut out as Alan listened carefully to the detailed instructions coming from his father. Erickson did not want Alan to think about his hurting or be worried about the bleeding, but he did want him involved in doing something about the problem. Alan became focused on getting exactly the right size of towel and on wrapping it correctly. Thus, the technique of distraction simultaneously created an opportunity for competency building. While at the surgeon's office, Alan's primary concern was getting as many stitches as possible. Erickson had initiated this thinking by telling him that he should put an end to Betty Alice's bragging about how many stitches she had. As Erickson explains, all I did was to redirect Alan's attention to one small aspect of his experience. Erickson had also encouraged Alan to pay attention to the details of the surgeon's work to meet his goal of outdoing his sister. When a person is given very precise and detailed instructions with a strong emotional emphasis on detail, there is a tendency to focus on how to respond. Therapy can be dichotomized as having one of two possible outcomes, either success or failure. Common sense and everyday experience tell us that success is more likely when it is the focus of attention. People who start to give too much attention to their own shortcomings tend to perform less well. The complete avoidance of a topic forces the patient to do her own speculation without the help of informed guidance. The woman who watched where she sat. A woman entered Erickson's office and hesitated before sitting down. She studied each chair in the room and made certain that she did not sit in the wrong chair. This was her presenting problem. She had to avoid sitting in certain types of chairs. She was exceedingly compulsive about this issue. Wherever she went, she had to examine chairs carefully. Not only did she feel overly self-conscious, but she was also prevented from enjoying the freedom that comes from carefree lounging. Erickson used hypnosis to communicate the idea of gradually working up to a state of greater and greater freedom from concern. Progression was central to this therapy. This strategy of progression is explained later. However, he was careful to emphasize the importance of hypnotic amnesia. He did not want her to remember his suggestions. She needed to be distracted from the task of becoming more spontaneous. Otherwise, the progress would be blocked by self-consciousness about spontaneity. She left his office not knowing for certain if any therapy had even been accomplished. One day, she happened to notice that she sat down without examining the chair. Then she realized she had been doing this for some time. This caused her to do some thinking, and she recognized that she had been going regularly to the movies with a friend, something she had not been able to do for several years. She had also gone to the symphony for the first time in several years. Sometime later, while describing her success to Erickson, she indicated that she never did recognize when she lost the need to examine chairs. According to her understanding, she just automatically began sitting in chairs freely and comfortably. Another common piece of advice is don't think about it so much, and the problem will eventually take care of itself. And this is often true. Many problems exist primarily as a byproduct of misguided prevention strategies. And I would remind us, class, students, that we are holding in place the things that prevent us from being able to act as we want, whether they are what is called subconscious thoughts or conscious thoughts. And subconscious thoughts aren't these deeply hidden, darkly camouflaged, inaccessible thoughts. They're just thoughts that we don't think about very much. So they are accessible. And you can follow the emotion of them to figure out what to do with them. But here's an external action tool in the word distraction, in this technique of distraction. Don't think about it so much, and the problem will eventually take care of itself. So if we're consciously anxious or worried about something, ruminating over something, having a thought that we don't want to think, then we distract ourselves, get involved in something, paint, do yard work, read, whatever distracts from that other thing. Many problems exist primarily as a byproduct of misguided prevention strategies. This is especially true for those individuals who have developed a neurotic preoccupation that, as a consequence, reinforces the problem behavior. This phenomenon can be understood using the concept of cognitive dissonance. Whenever a great deal of time, energy, or effort is put into something, then that thing has an increase in its significance. Whenever a great deal of time, energy, or effort, that includes mental energy and effort. If you spend several hours a day checking chairs and do this for many years of your life, then where you sit becomes extremely important. Far too important to do in a haphazard way. Then the act of completing the behavior, sitting safely in a chair, becomes an irresistible reward, thereby causing the cycle to repeat. Conversely, when a person does not invest energy in deciding where to sit, then the choice of chairs is too trivial to deserve attention. Although the solution seems simple, the circular dynamic behind neurotic preoccupations can't be difficult to break. When patients are distracted from non-productive concerns, there is an increased energy available for other activities. When they pursue rewarding endeavors not related to problem prevention, a new sense of satisfaction develops. When life feels more rewarding, there is not as much need to seek defense from imagined threats. Rather than live in a world of danger, an individual can experience a world of opportunity. Last case report. The boy with severe acne. A doctor who lived in Massachusetts contacted Erickson and said, "My son's a student at Harvard and he has an extremely bad case of acne. Can you treat that with hypnosis?" Erickson said, "Yes, but why bother bringing him to me? How are you going to spend Christmas vacation?" Her reply was, "I usually take a vacation from medical practice and go to Sun Valley and ski." Erickson said, "Well, this Christmas vacation, why don't you take your son with you? Find a cabin and remove all the mirrors in it. Eat your meals in the cabin and be sure that you keep your hand mirror in the safety pocket of your purse." The mother and son spent the vacation time skiing. The young man did not have time to stop and check a mirror. 2 weeks later, his skin returned to her normal condition. And that reminds me of a story that my grandmother, her name was Molly, did for me one time. I had 2 warts on this right arm, a large one and a small one side by side. And I kept fiddling with them and picking at them, and I was somewhere between ages 6 and 9 because I knew which house we lived in. And she was an RN. I thought she was magical anyway, but she also knew in medical kinds of things, and nursing was, there was more organic kinds of things going on then. She had a closet full of things that were good for the ailments and bobos and sores of a little child. But she took these, we were at my house where I was living, and Molly was there, and she said, "Quit that, quit picking on that." And so I didn't, but this was in the 1960s. So she offered me 11 cents for these two warts. She bought them from me. I'm buying those warts. So you can't touch them and you can't even look at them. I took the money. I was confused at first, but I took the money and kept my deal, my side of the deal. I was a pretty compliant child. So I did. I practiced not looking at my arm right there. And I don't know how long it was, but I remember one day checking, and the warts were gone. Those warts were gone. And my magical grandmother, Molly, had taken care of it for me. That story came to my mind when I read that last case report. Hope you enjoyed this. Hope it's helpful. Hope it helps you with your own process and your vocational experience.